Most of us don't ever want to be a patient in the emergency department. We hear all kinds of stories about them. We were all concerned about the very first slide and messing up, and here I've already started, so I've broken the ice for everybody else who's sweating it back there. The emergency department, we all hear lots of stories about them, and they can be busy and crowded, and we all know about the very long waits. Many seniors visit our emergency department every year at the Halifax Infirmary, over 16,000 last year alone. Seniors often present with more complex illness and chronic medical conditions. Many have to be admitted to hospital. The number of older people seeking care in the emergency department is expected to grow. We were inspired by a program in an emergency department much like ours, but in New York City. It is called the Care and Respect for Elders in Emergencies, or CARE program. Trained volunteers spend time with older patients who'd like to have someone with them for part of their long stay. As in New York City, we too are very concerned about the effects of crowded conditions and long waits for sick older patients in our emergency department at the infirmary. It's also called the Charles V. Keating Emergency and Trauma Center. We thought that the CARE program had potential to work here. But the Big Apple isn't quite Halifax, it's different. So to begin with, what we wanted to do was to be able to understand what it's like for older patients in our emergency department, both from the perspective of those seeking care as well as those providing care. We partnered with Caregivers Nova Scotia. This is a province-wide organization that supports unpaid family and friend caregivers and their care recipients. Many of their clients are seniors or are providing care for seniors. It is a wonderful organization. And speaking of wonderful organizations, the QEII Foundation and its counterpart at the IWK provide funding for research such as ours through the Translating Research into Care, or TRIC grants. One of the key ingredients for success is the involvement of patients, families, frontline providers, and people who manage resources in the system. People come to the emergency department because they are sick or injured. From our research, we learned that for many older patients and their families, there's a lot of uncertainty and fear about the unknown diagnosis. And this can be coupled with anxiety about wondering whether a patient can even go home. The emergency department can be a very lonely place. Many seniors spend a longer time there for a variety of reasons, like having extra tests. It's difficult for people to understand how things work in Emerge and why things take so long. Time goes very slowly. On the other hand, we heard from people working in the emergency department that there are so many competing demands that they must constantly prioritize. Some of them are understandable, like doing CPR on somebody who is having a cardiac arrest. But other important aspects of care include things like advising about medication or providing follow-up care. We all want safe, high-quality care for seniors in our emergency departments, but sometimes the many competing demands and priorities make it challenging despite everyone's best efforts and intentions. Is it possible that the CARE program could make a difference here? Every person who participated in our research fully supported the concept of the CARE program. They gave us many practical suggestions for implementing the program, like carefully selecting volunteers and training them well, and communicating about the program regularly. So, as a result of the research, we launched the CARE program at the Halifax Infirmary last November. We have 7 volunteers, and we are still recruiting, by the way. And each volunteer was carefully selected for their compassion and their respectfulness. The volunteers spend time at the bedside with patients, providing support, hearing devices, reading glasses, reading materials, a cup of tea, all to make a patient's stay as comfortable as possible. Not everybody wants a volunteer, nor do they see all people, But for those who do spend time with the volunteers, an empathetic listener makes a big difference. Volunteers offer a very valuable presence. One volunteer noticed on a monitor that a patient's very high heart rate settled to a normal rate just as they spent time together. Our research is just beginning. You're going to see in a moment our wonderful volunteers. This isn't everybody who helps to make this program happen, but they're fantastic volunteers. So I want you to take a close look at them. Because they make the program work. We've learned that sometimes low-tech works, and often for less cost, so it's more sustainable. And this has allowed us to just go ahead and do the work with the resources that we have. There is no dedicated budget for the CARE program. But that's okay, because it's been a lesson in valuing good old-fashioned frugal resourcefulness. And we don't know when there are going to be new healthcare dollars, but we do know that our approach to change is it's being resonating and happening in other parts of the world. For all of us who want to change healthcare, change starts here with ourselves. It takes innovation starts with heart. What that means is that you have to believe that change is possible and that change is worth it. And in our case, it's care and respect for elders in emergencies. Thank you.